Hello students, this is the lecture for chapter 13 on the temporomandibular joint. The TMJ or temporomandibular joint is a complex and precisely integrated bilateral joint that functions in speech, mastication, and deglutition or swallowing. The TMJ allows the mandibular condyles to move in both gliding and hinging actions. Take a moment to identify on your skulls the condylar heads of the mandible, the articulating surfaces of the mandibular condyles and temporal fossa, the intervening disc between the fossa and the condyles, and the capsule and supportive ligaments of the TMJ. The heads of the mandibular condyles articulate in the temporomandibular joint, or the articular fossa or glenoid fossa. At birth, the heads of the condyles are round and covered with cartilage. Bone forms around these pikes of cartilage so that the head of the condyle is porous. During development, the condyle heads grows in a lateral direction, changing to an ovoid shape by maturity. The ability to modify shape allows condylar adaptation to functional stress. The oval condyle consists of a smooth, bony surface covered with a layer of fibrous connective tissue. This image compares long bones to the cartilage bone in the condyle. The similarity is that the heads of the condyles and the long bones demonstrate similar growth patterns. New cartilage cells appear first, next cartilage matrix around these cells develops and is then replaced by bone. The difference is that the heads of the condyles and the heads of the long bones differ in that the long bones form secondary ossification centers. These centers produce cartilage bone junctions called epiphyseal lines, where the lengthening of the long bone occurs. There is no epiphyseal line in the condyle. Another difference is that cartilage cells in long bones are organized in long rows, whereas chondroblasts in condyles are scattered. The TMJ cavity is divided by the articular disc. The upper compartment is bound by the articular fossa above and the articular disc below. The lateral, medial, and posterior boundaries are enclosed by the capsule that outlines the TMJ. The lower compartment is bound by the disc above and by the head of the disc below. The articular disc is a dense, collagenous, fibrous pad between the condylar heads and the articular surface. The upper compartment has a gliding action between the condylar head and the articular eminence. The lower compartment has a hinge action between the undersurface of the disc and the rotating surface of the head of the condyle. When the jaw opens, each condylar head moves from the articular fossa and slides along the articular plane to the articular eminence while resting on the intervening articular disc. The head of the condyle rotates during the sliding action. The structure of the articular disc. It is thin and avascular in the center, but thicker and vascular around the margin. The articular disc attaches to the inner wall of the capsule anteriorly and posteriorly, but not medially and laterally, which is where it attaches to the head of the condyle. This structural design requires the disc to be immobile when the head of the condyle moves. The disc is covered with a thin layer of synovial cells called the synovial membrane. This membrane secretes a high viscosity fluid that moistens the upper and lower surfaces of the articular pad and the lining of both compartments. The TMJ is enclosed within a fibrous capsule. This capsule is composed of a synovial layer and a fibrous, tough, ligamentous outer layer that supports the articulatory movements. The capsule attaches to the temporal bone in the area of the articular eminence and the fossa and around the neck of the condyles. The capsule fibers fuse with fibers from the lateral pterygoid muscle. Laterally, the capsule is strengthened by the lateral ligament or the temporomandibular ligament. Medially, the joint is supported by the sphenomandibular ligament, which arises from the spine of the sphenoid bone and extends downward on the medial side of the ramus to insert on the lingula, or the spine of bone arising from the rim of the mandibular foramen. Posteriorly, the stylomandibular ligament arises from the styloid process and inserts on the posterior border of the ramus. 4 types of nerve terminals are located in the TMJ. Ruffini endings are sensory receptors that respond to mechanical pressure. Free endings sense temperature, pressure, and pain. Pacinian corpuscles are encapsulated endings of sensory nerves that act as a receptor for pressure and vibration. Meissner corpuscles are responsible for sensitivity to light touch. The articular surfaces of the TMJ will adapt to minimize the effects of mandibular function. Remember, the TMJ is the temporomandibular joint. If we are discussing dysfunction of that joint, it is termed temporomandibular dysfunction, or TMD, or myofascial pain dysfunction, or MPD. This concludes this lecture on Chapter 13, Head and Neck.